North Korea claims no coronavirus cases. Can it be trusted? Decades of isolation and international sanctions have ravaged North Korea's public health system, raising fears about its ability to confront an outbreak. It sealed its borders in late January, shutting off business with neighboring China, which accounts for 9/10 of its external trade. Park, a lecturer at Harvard Medical School who has worked alongside North Korean doctors to help improve the country's health system. It will overwhelm the system very quickly. Many observers of North Korea doubt its claims of not having any coronavirus cases. So they can say, "We have not confirmed it." Some accuse North Korea of hiding an outbreak to preserve order. The last thing the North wants is a social chaos that may erupt when North Koreans realize that people are dying of an epidemic with no cure. The North's leader, Kim Jong-un, is clearly aware of the threat the virus poses to his country's decrepit health system. By its own account, North Korea has quarantined 10,000 people. Such restrictions were needed for disease control because of North Korea's crowded public transportation network. Last month, Daily NK, a Seoul-based website that hires anonymous informants inside the North, reported the deaths of 200 soldiers, as well as 23 others, who were suspected of contracting the coronavirus. North Koreans are trained to obey government orders in a shipshape way during crises. By this month, some help began reaching North Korea in its efforts to confront the virus. Such rapid development of a potential vaccine is unprecedented, but even if it is proved safe and effective, it probably will not be available for 12 to 18 months. Unlike the flu, there is no known treatment or vaccine, and little is known about this particular virus so far. If the family member doesn't need hospitalization and can be cared for at home, you should help him or her with basic needs and monitor the symptoms, while also keeping as much distance as possible, according to guidelines issued by the C.D.C. Make sure not to share any dishes or other household items and to regularly clean surfaces like counters, doorknobs, toilets and tables. And remember to wipe the handle of the grocery cart with a disinfecting wipe and wash your hands as soon as you get home. Even if you just hang out in a park, rather than go for a jog or a walk, getting some fresh air, and hopefully sunshine, is a good idea. But retirees may want to think about having enough cash set aside for a year's worth of living expenses and big payments needed over the next 5 years.